Um, okay, so we have started the recording. I hope that is okay with everybody. So good evening. I want to thank everyone for joining us. And it is the third lecture of our health lecture series, which is Caste, Class and Politics, Health in India. And as most of us who have joined us so far know that this series has been designed to bring into the mainstream the discussions around caste and health in India, which often get sidelined. And in the first two lectures, we have had Sylvia Karpagam, who discussed caste and nutrition, and Diane Coffey, who gave us a lecture on maternal health in India. And today we have Dr. Murad, who is a mathematician at Middlesex University with interest in the theory of dynamical systems and application in biology. He has worked extensively on tracking COVID-19 in India, and he has written a number of articles on the pandemic in the media platforms like The Wire, Caravan, The Hindu, The Quint, and the others. So we are looking forward to learning from you, Professor, today. And of course, like I am not going to take a lot of time to discuss COVID-19 because everybody here has had some kind of a personal impact in their own lives as well. But I think the larger question which we need to discuss here today, which often obviously gets sidelined, is that how has COVID-19 pandemic also impacted the marginalized sections of the community? We saw that this kind of a it started as a health sector crisis, but it wasn't just that. Like it spread to, it showed the systemic flaws which existed, which had been ignored for so long. And we saw things like this exodus of the migrants and this kind of a misrepresentation of the death numbers as well. And so many things came into the forefront, but I think like most of us still did not get and this kind of a perspective of COVID-19 on how it was also affecting the marginalized communities. So with this short introduction, I would just call Dr. Murad to take over. We'll first have Dr. Murad speak, and then we will have some questions in the end, so people can just put their questions in the chat. And I would request that they don't unmute themselves uh, unless we request them to. So thank you, Dr. Murad, for joining us.
Thank you very much for inviting me to speak to you, and I hope you can hear me okay. If so, I'm going to start sharing my screen because I've got a few slides that I would like to share with you. So can you see my screen? Yes.
Okay. Yeah.
Just a second. I want to make it full screen, for which I'm going to just have to do a little bit work. Maybe this will have to do. Okay, let me try again, just to share that window with you. And I hope you're able to see the screen clearly now. Okay, so I'm going to talk to you about COVID and mortality, as Fiza kind of said, and Aditi said. And I kind of want to start by saying that, of course, there are a lot of gaps in my knowledge. And these gaps are partly just because I don't actually have a background in health, although I've done quite a lot of medical related work in one way or another, including quite a lot of modeling of health related issues. My background is not in health. I don't have a very deep understanding of health inequalities in India, the landscape of inequality in India. What I do understand quite well is the pandemic. And I do understand India's pandemic data and data around mortality reasonably well. And that's really what I can speak with some confidence about. So my talk is going to be a mixture of speaking about things which I can say with some confidence based on data, and then more kind of speculative parts, things that I can say with less confidence, but which I believe from the context to be true, and for which there is perhaps some limited data. And that's particularly true when it comes to talking about inequality and the how the landscape of inequality has affected the way that COVID has unfolded in India. I want to start with a couple of memes, which I'm just going to leave out there because they're so common. They were especially common early in the pandemic, but even now you hear them in one form or another. One is that COVID-19 is a great equalizer. It doesn't discriminate by caste, class, race, etc. I don't really want to say anything more about those for the moment, but in some sense, my whole talk is kind of centered around saying why these are clearly false, but they're not just false, they're also dangerous. It's a very dangerous starting point for trying to do any analysis of the pandemic. And in some ways, it is that starting point which leads us to where we are today. So what is this talk about? What do I want to talk to you about? I want to talk about some general lessons we can learn from India's pandemic mortality and from the discourse around mortality during the pandemic. Something went wrong both in terms of, why did so many people die? Why was the tragedy as huge as it was? But also in terms of, well, why are there these huge disagreements about how many people actually died? Why don't we know more? Why don't we know better who died? So something went wrong at many different levels. And we can frame the questions of what went wrong in the language of data. Was the data inadequate? We can talk about science. Was the science flawed? We can talk about politics. We can talk about propaganda. But we should also obviously be talking about inequality and the context in which the whole pandemic unfolded and what part that played in what happened. So I want to start with the kind of most recent controversy. It's a natural starting point, I suppose. The World Health Organization says that about 4.7 million people, excess deaths occurred. So these are extra deaths which occurred during the pandemic in India. The Indian government says there were about 500,000 people, 5 lakh people died as a consequence of the pandemic. And those are precisely the half a million official COVID-19 deaths. How can the discrepancy be so huge? If you're an outside observer who doesn't track Indian politics or pandemic data or anything like that, and you came into the situation at this point, okay, we've got a 10-fold discrepancy in estimates of something as harsh and raw as deaths. There's not estimates of some subtle question, there's estimates of deaths, and you've got a 10-fold difference. How can you get to a point where you have such a huge, stark difference in estimates of deaths? I'll come to that. I'll come to my kind of, what I want to say about that. But first, let me say, well, okay, there are a number of estimates in published or preprint form. I've put a few of the ones that I'm aware of there. In fact, I put all the ones that I'm aware of there. There might be others that I've missed out. And most of these are kind of similarly shocking to the WHO estimate. The WHO estimate lies within the range of most of these. It's slightly higher than perhaps the median of them, but then there are acknowledged kind of uncertainties. So there is a range of estimates there. What you won't find in that list is anything which is even close to 500,000. So suffice it to say that most studies, including my own work with Ashish Gupta, who is in the audience today, find between 3 and 5 million excess deaths during India's first 2 COVID-19 waves. It's a bit hard to put a number as huge as that in context. One way to think about that is that in a normal year in India, perhaps 9 to 10 million people die. And actually there's uncertainty in that figure too, which maybe I'll talk a little bit about later. But if we accept that figure, then COVID-19, the pandemic, has caused excess mortality, which equals about half a year's mortality, almost 6 months of excess mortality, 6 months of ordinary mortality on top of ordinary mortality. And that's one way of trying to compare what's happened in India with other parts of the world. As a fraction, as a percentage of annual deaths, how much are pandemic deaths. And by that measure, of course, that puts India as a very badly hit country. Needless to say, in an absolute terms, India is undoubtedly the country with the most pandemic deaths in the world. And I don't even think that's really a controversial statement to make anymore. It's also worth mentioning that there are acknowledged reasons why some of those estimates in that list that I showed you might in fact be too low. Let me just tell you a bit about those estimates, just so that you know where they're coming from. Well, they're coming from data. These are all data-driven estimates. They're coming mainly from death registration data. So that's a kind of key, crucial source of data, civil registration data. They're coming from survey data from a few different surveys. So these are surveys where people have been asked about the death in the family. So mortality survey data. And they're coming from, additionally, from data from various other government systems, for example, something called the Health Management Information System. So, kind of official data of one form or another. And perhaps there are a few other sources of data in there. So those are the kind of dominant ones. There are limitations in all of these studies, including in our own studies. We kind of acknowledge them and discuss them at length in our kind of preprint paper. The data is incomplete. You don't have it for every part of the country. Sometimes it's delayed, so what you're seeing doesn't reflect the full impact of the pandemic. The data, crucially, may underrepresent certain marginalized communities. So for example, if you have lower levels of death registration in marginalized communities, and your data is primarily death registration data, then you risk losing some of the nuance of what might have happened. So if you have kind of marginalized communities being hit harder, those deaths won't necessarily show up in civil registration data. So there are kind of dangers in that direction as well. There are also uncertainties around the background to this data. There are uncertainties about how many people die every year prior to the pandemic. And the estimates range from about 8 million to about 10 million. And actually, that's a shockingly large kind of range of estimates. So kind of government estimates at the moment are around 8 to 8.5 million. That's normal mortality, no pandemic going on. That's kind of what happens in a typical year in India. But there's actually quite a lot of evidence that the true number is higher. There's a cluster of estimates from different data sources, including government data. I'm talking about, in fact, the same data in some ways, but analyzed slightly differently. A cluster of estimates which say perhaps 9.5 million people die every year in India. The fact that we're quite uncertain about how many people die prior to the pandemic is itself very, very telling. It tells us about, of course, the weaknesses in the civil registration system, but it also tells us at one layer kind of further removed from that, that we aren't even adequately able to measure the weaknesses in the civil registration system. We don't have very, very good understanding of exactly how many what fraction of deaths get registered. So what is registration completion? So those are the things which lead to some uncertainty in the data, but nevertheless, there's a kind of consensus based on a lot of different data sources now that perhaps 3 to 5 million people died as a consequence of the pandemic, during the pandemic. Moreover, what is another kind of stark fact is that most of these deaths went uncounted. So I've put a little bit of kind of data for comparison here. So for example, the last time I looked, which might be slightly outdated, in the USA, excess deaths, if you compare pandemic excess deaths to official COVID-19 deaths, official COVID-19 deaths are about 90% of pandemic excess deaths. And in Iran, official deaths are about half of COVID deaths. In South Africa, about half of excess deaths. In South Africa, official COVID deaths are about a third of excess deaths. And in India, it's as low as 10 to 15%, based on those estimates I just showed you. And moreover, if you look at different states and different localities in India, it can be as low as 2 to 3%. So there are some states where perhaps as many as half or more than half of all pandemic deaths have been counted officially as COVID deaths. And then there are other states where that number could be as little as 1 in 50. And that's kind of that's a huge disparity, that as few as 1 in 50 deaths could have been counted in certain states and areas of India. And I want to come to the question of whose deaths are not being counted, have not been counted. In a sense, that is the key crucial question to help us understand why this has happened, but we'll kind of come to that. So what does that tell us? It says that even in some other low to middle income countries, death surveillance where death surveillance hasn't been perfect, even compared to those in India, it's been pretty poor. It's also been hugely variable within India. And I would argue that this failure to actually track pandemic mortality is really at the heart of how the pandemic has unfolded in India, how the Indian epidemic unfolded. Because if you start with the premise that deaths are many fewer than they actually are, and the pandemic is not so serious, the Indian epidemic is not so serious, we have nothing to be too worried about, that kind of then ties in with a lot of the decisions which get made around, around what you do to try to mitigate the impact of the pandemic and how you do that. I'm not saying that it's all about that, but that certainly plays an important part. And I would argue it played an important part in what happened in the build-up to the second wave of COVID in India, and perhaps to the deadliness of that second wave. So what went wrong? Well, we'll come back to this. We can frame it in lots of different ways. We can talk about bad data. Was it just that the data was poor? And if so, where does the responsibility for that lie? We can talk about, was it bad analysis, or people just kind of not really understanding what was going on? Yes, Aditya, I see your hand.
Yeah, I'm sorry if you've already discussed this. I just had this question that when we say that only 90% or 50% of of all deaths has been counted officially, what is this unofficial? Where is this unofficial counting coming from for all the other countries that you mentioned? Is this the survey data that we're looking at?
So specifically, it's all-cause mortality data, which is almost always from civil registration in all these other countries. So the kind of total, like for example, if I say in South Africa, 30% of deaths have been counted as as official COVID deaths, but that means South Africa actually has rather good quality all-cause mortality data from civil registration systems. And that tells us that there have been about 3 times as many pandemic deaths as official COVID deaths, and the same in Iran. So it's generally from civil registration. I hope that answers the question.
Okay. Yeah, thanks.
Yes.
Yeah, I'm sorry. It's just that it's a clarification. So, what is this year which we are looking at? Like, is it the first and the second wave of the pandemic in India, or it extends beyond?
So the different estimates actually take slightly different starting and end points. All of them cover a period about from, let's say, April 2020 to June 2021. So they cover the first and second waves, but often there's a kind of cutoff before the second wave has really finished playing out in terms of mortality. So especially when you take into account delayed death registration, some of the estimates are likely to miss some of the second wave mortality which occurred because of those delays. Others, like the WHO, actually takes the whole of 2020 and 2021, which is a decision that you can question, but it takes a kind of broader period of time than some of the other estimates. So there's a lot of variability.
All right. Okay. Thanks.
So where is the problem? Could it be that the analysis was poor? Could it be that just the kind of level of propaganda and politics that there was around data, around the need to claim that the pandemic was being very successfully handled? Or is there also a deeper story which is around caste, around class and inequality underlying all of this? And I think the answer is, well, all of those are true to some extent. The first 3 are kind of quite specific factors where you can point to where there were gaps in the data. You can point to where people constructed completely bogus theories and bogus models. You can, obviously, we all know about the level of propaganda and politics that there was around COVID-19. But the last factor is, if you like, the kind of underlying backdrop. It's the background against which all of this played out. And in some ways, it's perhaps the most important factor for that reason. I see a raised hand, but on my screen, it doesn't come up. So if there is a question, please interrupt. No? Okay. So let me try to kind of carry on with some examples and stories. I want to start with Mumbai. Mumbai is the city where I spent most of the first couple of phases of the pandemic. It's also the city whose data I know best of all. I'm using the example of Mumbai precisely because we understand enough about what occurred in Mumbai to be able to unpack the story, unlike perhaps in some other places in India. So it's a city of about 13 million people. The city is divided administratively into 24 wards. This is the area of the city which comes under the control of the municipal corporation, as opposed to the kind of metropolitan region, which is much larger. About half of the city, in fact, somewhat more, according to the BMC, live in slums. And I've color-coded on that map, the lighter colored regions are the regions with a high slum density. The darker color ones are the ones with a low slum density. So slum density can range from about 10% officially to over 80% in some of the wards. It's a relatively young city with about 5% of the population over 65, which is quite a lot lower than what we estimate the median kind of fraction of people over 65 in India to be. So if you look at Mumbai's data in the crudest possible way, and I'm taking us back to 2020, that's the kind of time period I really want to focus on. If you look at Mumbai's data in the crudest possible way, this is what COVID cases did in 2020. They kind of rose sharply, they plateaued for a while, they rose again, they came down, they plateaued. And what do we make of this? I mean, I kind of also give a talk to data science students sometimes, and I say, well, what story would you construct if this is the only data you had? You'd say, okay, you had a sharply rising epidemic, perhaps it was brought under control, but it wasn't really quashed, it wasn't quelled, then it rose again, maybe mitigation eased up, then it came down again. In a sense, that whatever story you construct, it's bound to be bogus, right? You just don't know the context of this data. You don't know why it's doing this. You need to have additional information. And that's the point of this talk I give to data science students, is that data by itself is pretty meaningless. Especially in the context of the pandemic, you have to have some contextual information. So let's try to build a few layers of around this data. Let's try to add a little bit more to it. Because you have ward-wise data released by the city corporation, and because the wards vary very significantly in terms of their demographic structure, and in particular in terms of how many people live in the slums and how many people live in housing societies, you are able to, with a little bit of maths, unravel what fraction of the cases likely came from the slums and what fraction likely came from non-slum residences, i.e. from housing societies. And what you find if you do that is you can really break the epidemic that occurred in Mumbai into two epidemics, and they're very different. There's the blue one, that's the non-slum epidemic, and that one you see a kind of rise in cases and then a continued